morning, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the condition spondylosis. So first is the introduction. Spondylosis, also known as spinal osteoarthritis, is a degenerative disorder of the spine. It is a general wear and tear that occurs in the joints and bones of the spine as people get older. More than 85% of the people over age 60 are affected by this condition. Spondylosis may affect the cervical, thoracic, or lumbar region of the spine. It may cause loss of normal spine shape and function. Although aging is the primary cause, the location and the rate of change is different from person to person. Next is the pathophysiology. So when the person get older, the disc fragment loses water content and then it become collapse. And this start in the nucleus pulposus, which is the inner part of the intervertebral disc, and in this the water content will decrease and will buckling inward. The annulus fibrosus, which is the outer part of intervertebral disc, will become thinner and bulge outward. And when the IVD becomes thinner, it will increase the mechanical stress at the cartilaginous end plate at the vertebral body lip. And the cartilage that covers and protects the joints wear away, and if the cartilage wears away completely, it can result in bone rubbing on bone. And to make up the lost cartilage, body responds by growing new bone in the facet joint to help support the vertebra. And over time, this overgrowth result in the bone spurs, which narrow the space of the nerves that pass through the vertebral canal, which result in the stenosis. And in addition, hypertrophy of the unicassate process occurs, often encroaching on the ventrolateral portion of the intervertebral foramina, that result in the pinch or compress those spinal nerves. Next are the types of the spondylosis, and these types are classified according to the region of the spine. So first is the cervical neck spondylosis. The complex anatomy and the large movement in the neck make this area of the body susceptible to the degenerative changes. And the neck pain from spondylosis is common. The pain may spread into the shoulder or down the arm. Second is thoracic or mid-back spondylosis. The thoracic spine is less commonly affected due to its reduced movement. If there is spondylosis in this region, the shape of the mid-back can round to the appearance of hunchback, that is called also known as kyphosis. Next is lumbar or low back spondylosis. So spondylosis often affects the lumbar spine in people over the age of 40. Pain and morning stiffness are the common complaints, and usually many levels are involved. If lumbar spine carries most of the body weight, therefore degenerative changes occur, its structure may get pain with activities such as walking, standing, lifting objects, or after long periods of the rest. Thank you.